Right, tuck and roll. I talked to him today for about an hour.
We will not, it's 5 o'clock. Okay, let's roll. Where's my gavel?
Shoot.
You want my Olipop?
Oh, because it's there. We don't have one.
Well, I was just
I'm
gonna
like,
go.
shoot, I'm like, where is it? But we don't have one.
Perfect.
I'm just trying to call the meeting to order.
All right, go ahead.
Dr. Hendrickson, we're gonna call the meeting to order.
This guy's out here lobbying for
Oh, wait, I
votes.
have to offer it to the rest of you.
When he runs for county commissioner, you got to remember this apparently.
All right, Dr. Hendrickson's almost back. So I'm gonna call the meeting to order at 5 o'clock on the dot. Please rise and join me in saying the pledge.
Back on.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we've got 5 out of 5 of our board members, so we have a quorum. And I feel like we've had very good attendance,
We
right?
have gold stars all around.
We've had a very long streak of.
Of 5 out of
Yeah.
5. Good job, guys. All
No,
right.
thank you.
Certification
allowed.
delivery of official notices of meeting was handled by Adam Licky. Did everyone have a chance to review the minutes of the regular meeting of February 28th, 2024?
Yes.
Okay. And all those abstentions were right for you?
They are, anything
Okay.
pertaining to the wastewater.
That's
was
what I
all
thought.
upset. Speaking of hot streaks, yes.
Okay. I wanted to make sure that everything, I thought it looked in order, but I figured
did
you
this time,
would
yes.
double check. Okay. Is there a motion to approve the meeting minutes?
I second.
Okay, motion by, that was Dr. Rude,
Mhm.
and second by Dr. Hendrickson. All in favor?
Aye.
Aye. Opposed? Abstentions?
Abstain.
Abstention by Melissa. Do we have, do we welcome Melissa?
Yeah,
to
I
the
was
board?
gonna.
I was
gonna do two things before we got too far, and one
Okay.
is congratulations to Miss Brakey
Oh,
from from the Board of Health.
Thank you. Oh, that's for
There's
me?
those as well.
Shoot, guys.
So congratulations.
Oh.
And then 2, I was going to have Miss Bowdren, if you'd like to stand up and let everybody, give a little backstory to yourself.
Oh,
I'd be
sure.
happy to hear.
Okay. My name is Melissa Bodrin. I'm obviously new to the board. I was very interested in running. I'm a nurse. I've been a nurse for 18 years. I was a social worker before that. And I have a 16-year-old daughter that goes to Kenston. So I was interested in giving back to the community and doing something. So I'm very happy to be a part of this, and I'm learning as I go. So thank you.
Well, we're excited to have you.
Thank you.
Yes.
Yeah, I think you'll be a great addition to the
Thanks.
board. Okay, moving on.
Yep.
You're good, Adam?
We're good.
Anything else?
Nope.
Okay, population health.
No update unless anyone has any questions.
This one's a new business, right?
Yeah.
Yeah, the only thing I was gonna ask about the Buckeyes, buckle.
Yes, the grant.
Yeah, the car seat program was, can we have a social media post about that, or has there been recently? I'm not totally glued on it.
Maybe
I
but-
don't know if we've done one
Recently?
recently. We do one in the past because we do
Okay.
have people come in and do that, but I don't know if we've done one just recently. But we do them, they're on the schedule to go out.
Okay, to go like quarterly or something like,
Yes.
okay, all right. I mean, I don't always look at the social media, I saw it when people are freaking out about the eclipse post. I did see
I do appreciate your administrator Adam Licky account.
It was either let everything go into chaos or answer questions. I chose answer questions.
Well,
Yeah.
that's, they're
There's-
tough choices. All right, any questions on population health?
The only comment I'd make is that flu cases are still
Mhm.
pretty high. It may not reflect it in the sheer data just for what's reported in John County, but
Mhm.
we still have significant amount of COVID flu and RSV in Northeast Ohio. Plain Dealer just last week reiterated that the cases are still high. They're starting to come down a little bit, but
Yeah.
we're still seeing a lot of cases.
Yeah, we've seen a lot of. It's not. I'm not sure always what it's diagnosed as. 'Cause we don't always hear that. But there's like a stomach, head. It sounds like the flu, but it seems like that's going around. It's kicking butt for like 3 or 4 days. It's not like one day and done. So that's been going around pretty consistently. We've been hearing about from most of the schools.
So people who think it's too late to get vaccinated, it's not too late.
they can always, we will, if they would like it, we're always here.
Okay. Mr. Lark, you wanna do the EH report?
Yeah, just two quick things. One, we were at Troy Township last night just to do an educational thing at their trustee meeting for operation and maintenance. We're into the third phase of that third grouping of townships, and I think we are scheduled for every single one, if I remember right.
So how many townships have you gotten to so far?
6 or
I thought it was 6 or 8, somewhere in there.
I think we're in the third phase, so we must be
Yeah.
we must have been to 6 now.
Okay.
Yeah.
And then, so we have,
And Troy was a good one because I was not able to go. I was not feeling the greatest. But one of the officers I was talking to said that there was some posts ahead of that saying how terrible it's going to be. Everybody needs to show up in force, let them have it. It's corruption.
Okay.
And then when they left, the media post that came out after that from the same person was nowhere near as bad as we thought it was, but I still don't like it.
wow.
So, but it was very funny. He said to see because he lives in Troy, so it was a very quick change in terms of direction of like
That's
terrible
good.
to it's not what we thought it was.
Yeah.
I was gonna say, I'm sure there's, like the other townships, at least what I've seen, like from my own,
Mhm.
those are a good place to see if people aren't coming to the public meetings, the comments,
Yeah.
and the concerns, curiosities.
I've spent
As you know.
far too much time answering questions on
Yes,
Facebook,
as
more
I've
than I would
seen,
like to
right?
admit.
Yes, I've-
Yeah, but it seems like that's where the negativity is.
Correct.
It's not necessarily
Correct.
in person.
Right.
No one
Yeah.
actually
Yeah.
shows up to
The-
these meetings and is yelling at.
the
at
goal-
least for
Oh,
me,
there's a
prior
couple.
to being in,
Yeah.
is what I
there's a
read.
couple.
And as I mentioned,
There's a
that was,
couple.
Yeah, they come in person, yeah.
that was the big reason I created that GPH administrator page was so that when Dan and I go to where Dan does our staff, they're not yelling at them. They can yell at me ahead of time and at least get some of an answer, and then they leave Dan and Christie alone. So.
Okay.
Dan will also give you guys an update on the Helligers discussion.
Oh, yeah, I
we
saw
do it
that.
now because Mr. Kaufman is here. After
Okay.
Dan gives you an update, if he would like to speak, he can. Him and his wife, his better half. She's very nice, nicer than he is, I'd say. Just kidding. I'm just kidding. He was good. But Dan, would you like to?
Yeah, it's not a huge update, but we went out there and, we took the rules with us actually and walked through the property. And so everything we could at that time that we, measured distances from property lines, all stuff, everything seems to be right in line with all the rules and the
Okay.
requirements of what they're doing. The only part we really couldn't see is because it's not the appropriate time of the year to be planned at applying the sewage, because you have to do it during the dry months. You can't do it when there's wet or frozen ground.
Okay.
So we'll, when that starts, when we get the right conditions, he said we're welcome out there anytime to come observe them to do that, so we'll go do that. And that'll finish up like the second part of our kind of investigation into
Okay.
it. But so far,
Very
we've
good.
been happy with what we've seen.
Okay.
Yeah. Mr. Kaufman, would you like to add anything, or Mrs. Kaufman?
I would just like to add that this has been going on for 20 years. These allegations, 20 years.
Okay.
And he's a neighbor right out in front of my dad's old house, right in front of my driveway. And a lot of the stuff that was in the paper was not even true. And it's just, guy's been harassing me for 20 years.
Yeah, one of the first things Dan and I did was go out and meet Mr. and Mrs. Kaufman.
Yeah.
They were kind enough to show us the property, invite us in, drive us around. And like Dan said, we printed off the rules from back when they were adopted by the board and went through everything besides seeing spreading. Everything looks like it meets exactly what the board set up years ago,
Mhm.
and then re-upped when Mr. Quaid was here as well.
So are you a neighbor at the property by where the allegations are occurring?
Yeah, Jimmy.
Okay,
Yeah,
okay.
he is. He's in front of me.
Okay, got it.
So, man, the board, we do apologize, and I think that this will help clarify the final decision down the road, hopefully stop some of this.
Uh-huh.
Yeah.
Yes.
Yeah. So we'll go back out in the summer when it's drier and warmer, and that way we can see what it looks like when he's spreading, and just to, ironically give a sniff test and see where it goes. So ironically, that is exactly what we're gonna do. So
That's part
yeah.
of the job, huh, Mr. Like the more glamorous parts, the sniff test.
Gotta train
That's why you go to college, right there.
Yeah, for the
It's not what you think. If you come to the property, you'll really be surprised. I took Dan Whiting there 12, 14 years ago. In the morning, gets out of the truck, my pickup truck, we drove right out in the field, he gets out of the truck, and I said, this is where he's laying a fight, and he's like, where at? I said, where you're standing, and he jumps up, he's looking like this, and he told me, he says, I was expecting toilet paper and waste in a pile. It's not like that. So
Okay.
he was really surprised.
Yeah, if you're out there, you'd never think,
Yeah.
like, thinking that people are applying sewage there. You would, it looks like a grass field, really. So,
Interesting.
It is.
Yeah, I mean, you hear that and it sounds,
Yeah,
Yeah.
the way
Not
he's
appealing.
described it in the paper, the splash fence along the property, I don't even go near that fence to land apply. And they were out there to see that. And the neighbor's property in the back has a big pasture, has cows and horses all the time. And then when it rains, you can stand on my property and there's a swale of just manure and cow feces coming down my
Coming into your-
driveway.
okay.
It is what it is.
yeah, yeah.
But it should be reversed. He comes onto my property.
Okay.
So
Well,
I think
it
the
should just
story.
be objective for.
The story was,
Yeah.
in the paper, all the distance is 150 feet from the school. No, I'm 650 feet.
Oh, wow.
And Dan, I
Were
actually
you
did-
reached out to at all regarding the?
Who?
Were you reached out to at all regarding the article that came out? Just out of curiosity.
By the paper?
Yeah.
No, I
No.
haven't been. And I don't wanna keep, I'm not.
Right,
Yeah.
but I
I
just
wanna
meant
be under the
before they
radar.
wrote it,
I
maybe.
run a great business. I don't
Yeah.
wanna be the spotlight of the county.
Yeah,
Right.
no, I understand. I think they did say in the article that he was reached out and before
Okay.
and they couldn't get a comment.
Yeah,
or
I
they-
just.
And Dan, I
I mean, I'm not saying they
Crazy.
did or they didn't.
The
I just think
more-
that's what
the more that I
story said.
accuse this man of doing this to me, the more he's gonna keep doing it. And
Yeah.
it seems to be every couple of years, he picks on one of the neighbors. Right, Jimmy? He picks on one of the neighbors. So Kenny Hoare has my dad's old farm, has the barn, and Mr. Helliger claimed him of dumping porta potty waste in the pond behind the barn, where the kids swim and play on the weekend. And he said that under oath at the township meeting.
Oh,
So that's a pretty big accusation,
yeah,
you know?
okay.
So,
But Dan and I did a rough estimate of where his gate is to where the school starts, and it's a good distance. It wasn't,
Okay,
you know,
wasn't
just-
Wasn't
just
really
a-
close to the.
yeah, we didn't get out and measure with measuring tape, we just kind of did a tachometer on the truck, and it was a decent distance.
I have it on my phone, 650 feet. I did it with the.
Yeah, yeah.
tool. And that school's only a couple years old. I was there for 20 years, so when they gave the permit for that, they knew they were there. And the president of the school was my neighbor touching my property, and he had contacted me, and Dan, I gave the number to him to call him. He'll really tell you the side of the story about the neighbor.
Okay,
He owns the school property.
Yeah, he owns a school property.
okay, I see.
So I want to give Mr. Kaufman a chance to address you guys. Dan obviously did the update. We'll know more in the summer months when we go back out one more time. But as of right now, it meets all the criteria that we go by, so we
Okay.
don't have a problem with it.
I mean, it's like a
mentioned-
completely different story than
Yeah.
what we
It is.
we heard last
Different.
week,
You're
or last
welcome,
month.
Just
you're
some-
welcome to call my phone number
Honestly,
anytime.
it is, truly.
You're welcome to call my phone number, and I'll take you out there in Orlando Plain. You'll really be surprised that it's not like they're thinking, because I don't operate like that. I don't need to operate like that.
Just grass, manicured grass.
Yeah, manicured grass, we
Really,
cut
we
it.
let it grow up a little bit and then mow
Cut
it.
it.
Well, I
And we
think it's
do all-
good you came and, informed all of us.
It is.
And just for our education, can you help us as far as telling us what's this is a dumb question, what's actually being delivered out there?
Just
Are your-
residential septic tanks. I don't do commercial.
Okay.
I'm not permitted to dump commercial on a property, like the newspaper stated that I'm a commercial septic cleaner. I just do residential.
Okay,
So you're not gonna find heavy metals like that you find heavy metals in a commercial aeration tank.
And residential is just, that means just taking it out
Household
of the
sewage,
tank, loading
yes.
it, and,
Yeah, and we
He
lime
mixes it with
stabilize
lye.
it.
Yeah.
I'm
We
sorry?
lime
He
stabilize
mixes it with lye, which is one of the questions I had.
It
and-
kills all the pathogens, that's
Yeah.
what I have
Yeah.
to do.
Yeah.
okay,
I did mention to Dan, potentially it'd be voluntary basis, but something we do on an annual basis, either with signage or a note that we're out there to inspect it, that he'd be able to produce to maybe help out a little bit.
Pardon me?
Like a signage of some sort that we could provide you, a letter that we monitor on a yearly basis or whatever.
Well,
It'd be
really,
voluntarily.
there's, for 20 years, Dave Sage has been inspecting it.
Yeah, so they
And
can-
I have every paper that he's ever
Oh, good,
wrote
okay. Yeah, maybe
at my
some
house
signage or something.
in a file.
That's actually, I think, a great idea.
Yeah, some of this
Yeah.
public.
Well, you're really
if you're-
supposed to
If you're
visit
agree
it
to, yeah.
and inspect it
Yeah.
once a year.
No, I know, but to have a sign out
Yeah,
there
something that,
that states the truth.
Right,
like a seal or whatever.
right. But I do have all them papers.
Yeah,
I have
that's
every
good.
allegation that this man's ever made to me in the folder, but there's no reason to bring it up here because he's just back at it again.
Well, that's a shame you're being impacted by it. I think we have some.
It is.
Some ability to maybe help out with that.
Right. I just don't wanna be in the news, I have no
Yeah,
reason.
right.
It's hard enough to run a business right now, but to have them allegations against you, and somebody that doesn't know, probably has a lot of questions, but I'm here to specify that I'm doing everything that I should be doing, and I wanna keep it that way. I got a lot invested there,
Yeah.
with equipment to keep it up, and, it's a project.
Definitely.
Any other questions, Mr. Kaufman?
No, thanks for coming in.
You're welcome.
Thank you, sir.
Thanks
Thanks
for
for
your
your
time.
time.
Thank
To
you.
hear that side of the story.
Thank you.
Thank you.
Anything else as far as EH goes? Mr. Millard?
I don't think so.
I think everything else was pretty.
Yeah, no questions? Admin or report, Adam?
No update other than what's on there. I do have a small presentation to give you guys tonight, just for part of my master's, but also something that I believe was wanted from here as well, which is like an update on kind of how the cross-jurisdictional will go. So
It's our
it-
anniversary.
Oh,
Our first
it is.
anniversary. How about it?
So it kind of worked out.
Happy anniversary, guys.
Right.
It's been a journey this past year.
If you guys would like, I can do it now, or I can do it after Mr. Graham does his.
Oh, I'm sorry.
No, do you want to do it now or after Mr. Graham does his report, or at the end?
15th.
Whatever you want, Adam.
I can do it now if you
15th
want.
that's in March.
Yeah, it
That's
was
why
the
I remember
15th.
the date of when
We were trying to remember the exact
Right,
date, just
Oh.
for, we should have gotten you guys flowers.
20, I think.
That's what flowers.
I'm gonna put up on the screen behind everybody, and unfortunately, there's not really a great place to present in here, so that's kind of why I have these tables angled for all of you. So, Bridging Borders, a collaborative approach to public health. I'm gonna try to go through this somewhat quickly, so we're not here all night. But background of this is just a background of Lake and Geauga Health Departments, the prior partnerships, why enter into a cross-jurisdictional or a CJA, as we reference to in the future. Highlights of the CJA, cost savings, opportunities and obstacles, and a conclusion on it. So background of Lake County Health Department, which is LCGHD, serves a population of over 232,000. Majority of staff are part of a union, about 87 total staff members, budget of $8.6 million. Nationally accredited in 2014. It's Ohio's 11th largest health district by population. Population is estimated at 86% white, 4.8 Hispanic, 4.5 black, 4.6 other. Median household income about 76, almost 77,000, and a median age of 43.9 years. Geauga Public Health, or GPH, serves a population of about 95,000, about 95.5. Staff are not part of a union, about 27 total. Budget of $2.7 million, nationally accredited in 2021. It's Ohio's 29th largest district by population. Population is 93% white, 2.6, 2 or more, 1.7% black, and 2% other. Median household income of $97,162, and median age of 44.6. For those that don't know, because a lot of people tend not to, it seems like it's prior to 1840, Lake and Geauga County was actually one single county. And in 1840 they split, and that's when you had Lake County come out of that. When you look at the two of us as one combined entity looking to apply for grants and things of that nature, we become the 9th largest health department by population, and we become the 6th largest when looking at square miles when we combine our forces together to go out for grants and things. Prior to that, we're actually 81st and 88th. So we were at almost the very bottom in terms of square miles. Combined, we're almost at the very top. We're actually only let's see what my notes were. We're only the next high, so we're 627.65 square miles combined, and the next one is 631.97. So we're like 5 or so behind number 5. Yes, sir.
Do you know historically what led to the split?
I don't know that. I think, Ron, do you remember what that was?
I don't remember the reason, but the geographical land they thought was under the water, they thought it went straight across instead of on an angle. So basically on paper, it looked like we had a square mileage for Lake County to break away. They did not, but I don't remember what the catalyst was.
It was the Great Civil War between Lake and
The North and the South happened again.
Yeah.
And anything you guys would like to see changed, please let me know, because originally I was planning to do this next Wednesday, so this was kind of like a little bit of a rush job to get this done, so I can still submit it on time. So prior partnerships, prior to 2017, Lake County General Health District and GPH applied for grants like air pollution, HIV medical case management, traffic injury prevention and immunizations, WIC, and tobacco use and prevention. In June of 2017, that was actually when I first started here, I was providing fiscal services and some HR. In October of 18, there was a contract for 20 hours of epidemiological services. In 2021, that's when I became the administrator for 32 hours a week. And March of 2022, Mr. Lark came on board at 40 hours for environmental health services. So the why of the CJA. So accreditation costs, inability to or difficulty to recruit staffing and offer career advancement opportunities, ODH grant management shift from advanced funding to reimbursement, creating efficiencies between counties for service providers, improving key staff search capacity and program redundancy, increasing costs of redundant and niche software, improvements to customer service, desire to reduce community health assessments. And I'm going to kind of go over some of these slide by slide, but accreditation costs, that was our first year was $14,000 alone, $5,600 every year after that. The hope is that we can reduce those costs rather significantly with some of the stuff Ron's working on to kind of like a CJA for accreditation to some degree.
And does that include the cost of having an accreditation
No.
coordinator? Yes, so
That-
those
that
costs
is
are actually a
just a
lot
fee.
higher.
That is just their
Right, okay.
fees. The last time Ron and I looked at this, and the last time we did it here in Geauga, you're probably talking $100,000 to $200,000 a year just for accreditation costs.
Right, okay.
Between personnel costs, when Dan and I have to do things, meetings we have to hold, Ron's time, it's easily in that area
Yeah.
for each county.
Because I thought that sounded low when you just said.
Yeah, that's sorry, and I should
That's just
mention that's
application
fee.
just their fee, and that's it.
Okay, that makes
So,
more sense.
ODH management or ODH grant management, that used to be where you got all the money up front, or at least some of the money up front, and then you worked it off and you got more money. Now it is you do the work, then you get reimbursed for many of the grants. Some have a deliverable base where you get deliverable done, then you get funding, but it's not up front anymore.
Okay.
Efficiencies for service providers, one of the really tough things that I know Dan probably more than anybody dealt with was you do it one way in Lake, you do it one way in Geauga, and because we're so close, those service providers are in both counties. And it's more paperwork in one county, it's more frustration somewhere, and it's more of a seamless thing of you can kind of get everything done relatively quickly. If Ebola 2.0 happens or whatever 2.0,
You have a
the
question,
ability,
sir?
oops, sorry, Dr. Anderson.
Are there any adjacent counties that are not accredited?
Ashtabula's not, is it?
I believe they're not yet.
Yeah, I know they're working on it. I don't know if they are yet technically though, but they are working on it because I know Jay had mentioned
There's
that.
now, because of some of the compliance issues nationally, there's like a prepare to be accredited pathway. And that's what there's like self-exploration kind of thing.
Yeah.
So that's where they're at, I think.
Yeah. The surge capacity and whatnot, one thing that we do even now is when Geauga, let's say, needs an extra nurse for something, or Lake does, we can kind of switch the staff to help out. It's usually a swap, like day for day. It's not like one person makes out and one doesn't. It's just a day for day swap. And that's been super helpful in general, also for keeping people busy. If there's a slow time, we can actually get them doing other things that may be more important at that time. But for the most part, everyone is swamped. Increasing costs of redundant niche software, so things like the environmental health software and other things, these costs keep going up. And usually there's a base rate you pay plus a user fee. Now we just have one base rate and then we have the user fees, obviously, but it cuts down costs on those that we're looking at. Customer service, obviously, one thing we noted even at the HDAC was they've noted almost zero complaints coming to the HDAC at all with customer service complaints. And before, that was a very different story. The commissioners alone used to give me daily complaints, it felt like. Community health needs assessment, one of those things that we have to do legally, but that costs an arm and a leg, and we have been working with Lake for a little while now to offset both sides of the cost, because both of us have a significant cost impact on that, which is somewhat frustrating because it feels like when you get whatever the CHNA, the community health needs assessment is, by the time you get it, you can't even work on it, you already get the next one. And you start to work on it, you get the next one. You really can never get the work done, and the hospital also moves on to their next thing. And so that makes it tough where it's a gigantic cost that is required, but you really never actually get to those
You
things.
never meet the needs.
No, you're always on to the
You
next
just
one.
say what the needs are.
Correct. Unfortunately,
You
yes.
can't even track it because the data's behind, so.
Yeah.
Oh my
It's basically in the blind.
So
Do
we
you,
are.
do you all have a sense of percent population of Amish in each?
So there's really none in Lake that I'm aware of. In Geauga, I've heard as low as 12 to 13,000 and as high as 30,000. The big thing is if they felt the census or not. But obviously they're having far more kids than most of us Yankees. You know, I was 2 and done. They tend to be like 8, 10, 12. So a couple more of them is reducing overall administrative costs. Obviously that was one of the largest ones. Data-informed decisions when it comes to public health futures reports. Similar changes in Lake and Geauga counties already happened, which is like the Head Start program, Recovery Center, Lifeline, Public Transit, and Educational Service Center. Obviously also cutting overhead costs and making more efficient programs for the taxpayers. Reciprocity in policies and workforce development, training, social media, emergency planning and preparedness. Those are all things that now we can kind of work cross-county, because most things we prepare for, like the power plant is one of the biggest ones. We work as a cross-county anyways. We're all involved in that anyways. Diversity of revenues and reduced duplicative costs obviously is a huge one for any entity. It should be for government as well. And increased need for federal grant acquisition and planning capacity. So obviously, accreditation was supposed to get us all this money, this like crazy amount of grant revenue. We've seen like none of it really. And that is something we keep pushing for with a larger population base to pull from, larger square mile-wise as well.
Yeah.
We have more opportunities to apply for more grants that we're going to start looking at as well as they come available in a cycle. So we're just waiting for those cycles to come up. So the highlights of the cross-jurisdictional, if someone was new to it, would be the statement that the GPH Board of Health retains control of all of its policies and guidance. So they're in the full driver's seat of it. Statement of the maximum overage that can be incurred in a yearly billing. So two concerns, those are probably the two biggest ones. One was Geauga gave up all of its sovereignty and nothing mattered and anyone could do anything they wanted. That's not true, obviously. That's why I was very vocal as well to make sure it didn't happen. And then the other one was, oh, well, they're going to raise the rates tomorrow and it'll be 100% over what you thought it was. If I remember correctly, the CJ actually says no more than 5% unless agreed upon. So I can't just go magically start charging you guys 25% more out of nowhere and someone just signs off on it. That's actually built in. Date that LCGHD will invoice GPH. We still do the best we can on that one. Length of the contract, which is 5 years. Statement of positions that LCGHD must staff. Statement that additional positions can be added with approval from both LCGHD and GPH. And GPH will be responsible for equipment, information technology, services, physical locations of vehicles, etc. And obviously the big reason for that last one is if GPH were ever to decide, hey, we are good enough now, we'll go back on our own, you need all those things. If you didn't have them, you'd be starting from scratch with computers, cars, logo, branding, everything would be a fresh start. So it leaves, again, GPH in control of their own way. We'll have to add Miss Melissa over there to this. I've already butchered her
New
last
photo.
name.
I know that is
Yeah.
quite the photo. It's like
so,
our mugshot.
Hi, a bunch of handsome, pretty people. So, for policy making for GPH specifically, they make the policies for Geauga County, and the CJ is meant to reduce the day-to-day overhead of. Sorry, I was supposed to
Yeah, I
say
was gonna
GPH
say,
while
typo.
maintaining local. Sorry, that's on me.
Sorry.
This was a little bit of a rush, as I mentioned, to have right tonight. And the same thing for Lake County. And for those who don't know, Geauga Public Health, in your bylaws, you have 5 board members. In Lake County, they have 14. So it's actually the second largest board, the last I remember. And again, Lake County sets policies for Lake County, and it's meant to reduce the overhead costs for Lake County, as GPH is supposed to reduce GPH's overhead costs. Billing and contract dates. So we do provide the billing by the 10th of each month. It usually goes a little bit longer than that to make sure we get all the approvals and we give all the background data to Ms. Brakey to look over. It cannot exceed more than 5% of the total budget in total billing. The contract will be effective for 5 years and renewed for another 5 years if not ended. There's a 2-year notification of termination. Obviously, for both sides, you need that. We have to, in essence, transition staff, and you guys have to bring staff on. So you can't do that overnight, obviously. GPH will continue to receive all revenues and revenue for programs, contracts, and grants they did prior to CJ. So the reason for that also was there's 2 different reasons for this. One is for auditing, it would double count the revenue because technically Lake County would get it, then transfer to GPH. The other reality is I don't want to be responsible for transferring the revenue because if I'm wrong, I look like the bad guy. It's easier to say, hey, all the revenue goes to GPH. You guys just pay a simple bill like you would in any other contract. Management of staffing. So the management staff positions that are included in the CJA are the health commissioner, administrator, environmental health director, nursing director, medical director, administrative clerical specialist, and a fiscal coordinator. The non-management positions are 7 sanitarians or registered environmental health specialists, they're now called, 3 clerical specialists, 1 health educator, 1 plumber, and a half an epidemiologist. Right, we just cut them right in half. You guys just,
I figured that's how that works.
we took the side we wanted first.
We got the better looking side though, I heard.
Yeah.
We're very good with that.
Equipment materials. So GPH is responsible for providing all computers and information technology devices, responsible for all vehicles and for inspections related to government business, responsible for providing a physical space for LCGHD to provide the services for Geauga residents, and GPH is responsible for all training, travel, and other associated costs with operating programs in Geauga County. And obviously, as mentioned before, that's that you guys still have all your own autonomy if you ever decide, hey, tomorrow we want to go a different direction. Additional staffing that has been agreed upon up till now is a registered environmental health specialist, and that's to help with the operation and maintenance program and paid for by the O&M program. A lead registered environmental health specialist, which again will be the O&M program, paid for by the O&M program, and a half of an O&M supervisor. which again will be paid for by the O&M program. It'll be split with Lake, again reducing costs associated with that program while still paying a very competitive rate to keep people.
Yeah.
These positions were added again for the O&M program and will be covered by that revenue. The GPH, ServSafe, and new opportunities. So one thing we did was that the ServSafe and Person in Charge used to be offered in Lake County because they really weren't offered here. So if you're in Geauga, you had to drive to Lake to get those services for restaurants. Now they're offered here in Geauga County, actually in this room.
I don't know what those are.
So they're for restaurants. You have to have one person in charge. Remember
I don't know, let's see if you know.
Geez. So you
Not ours.
have to have
Yeah.
one person in charge on the management team during the day. One shift, one per shift.
One per shift.
One per shift.
Yeah.
And then all of them have to be ServSafe certified, the
No.
employees. See?
Oh.
Dan,
Yeah.
good.
Where's the rubric?
So the person in
Dr.
charge is
Boyne.
typically a 3-hour class, it's basic food safety, and there always needs to be someone there that's got at least a person in charge.
Okay.
And then one person at each facility needs to be ServSafe certified, which is a 2-day food safety class with a test afterwards.
Got me.
Are
sir.
you embarrassed?
I am.
Yeah.
I try better
The
than that.
flashcards didn't
You
work.
that was pretty good.
It's close. You're close,
The,
yeah. It's a lot.
James like, I'll give you like half a demerit.
minus.
The LCJC Water Lab, one thing that with the O&M program, we need to be able to do more water samples. And so we can train our staff and the Geauga staff to be able to do water samples and how that works. And so, again, offers more opportunities, more advancement opportunities, and we can do more things in-house as a team. And then, actually, the thing that's in front of you right now, that packet, but also Ron talked about last time, is the Suicide Opiate Death Review Committee, and just working to create that committee in the community.
Did the commissioners approve that?
We will have to go to them. What's one of the questions tonight is, are you guys
Oh.
okay with us taking it to them?
Okay, I thought we
And-
approved that already.
Yeah, so,
yeah.
yeah, so we gotta get a document, basically I produced the materials that you wanna review. It doesn't need approved or anything, but just wanted you to be aware, and the next step we'll meet with them and
Okay,
go from
I
there.
just wondered where that was. Okay,
Yeah,
go back.
so we'll,
Back to you.
as long as you all are good with it, we'll take it to the county commissioners. We'll talk about that a little later. So the cost savings, which is obviously the main driver of all of this, it's a little hard to see, it's hard to fit all this on one page, but in 2021 and 2022, what I did is I took the actual expenses from the audit report, because those are verified numbers, there's no, guessing those. So in 2021, the salary and fringe expenses were about $1.9 million, and total expenditures were 2.7, give or take. That did include both a health commissioner full-time, and a full-time environmental health director. The health commissioner noted at the bottom was let go in August of 2021, and we went to a part-time health commissioner and myself as administrator in September, roughly of 2021. My position previously for doing finance was about a $50,000 to $60,000 contract, so it doesn't show up in salary or fringe. So you have to add that to that 1.895 number. When I did administrator, it's probably closer to 75,000 that first year because it was about 3 months of that. So I had maybe 75,000 to the 1.9 million dollars. In 2022, it was $1.6 million out of a $2.6 million budget. Part of the reason for that is the health commissioner's out of that budget, and also the environmental health director's out of it. Also, there were no contact tracers for the most part of that year. There was the COVID contact tracers. So there was a reason that did come down some. It wasn't just magically happened. But realistically, you'd probably have to add another $200,000 to $225,000 to that number. So it'd be like 1.83. So it'd be really close to where 2021 was. Very close. And then in August 2021, that's when we moved over to the part-time health commissioner. And if I remember correctly, we actually didn't hire Mr. Cameron until I want to say January, off the top of my head, was when he came the part-time health commissioner at like 3 hours a week or something like that. Estimated cost savings, so the important part. So the personnel budget for the calendar year for the CJA was almost $4 million. The CJA using the 2023 budget would provide using that number up there, so when it says 2023 budget, it's that 1.371 number, would be a cost savings about $598,000. Now, it'd actually be more than that because I'd have to go back and remove 3%, the 2022 and 2021 to get back to those numbers, but
Oh, you're saying like for inflation?
yeah,
I see, I
but to
see.
be ready for tonight, I kind of just did what we had.
Yeah.
In 2022, using the same thing, it'd be about a $508,000 savings, and then the 2023 personnel budget of 1.6 million. So it'd be really close to that number yet again because you had 200,000 to it. And I apologize, there's actually there's a number missing. That's why. I'll have to get that. I was going a little too quick on this, obviously. The 2023 number is right around the $508,000 mark as well. That's why that asterisk in the 2021 was supposed to be a separate number, and I missed that. So how I got the 2023 budget was I took what 2022 salaries and fringes were and just multiplied by 3%. And I said that's probably what 2023 would have been. And then you'd have to add $200,000 that number for Mr. Lark's position and myself, because that would take you back up to that full staffing, and subtract it from the CJA. And as you can see, that'd be like 1.879 million, and the CJA is 1.37 million, so that's about $500,000, really close, like $508,000 again, is where that difference would be. And then what that does not reflect is that in 2023, we did the work for the House Bill 110 program and implemented the O&M program with no additional staffing almost at all. So we did that all under what the contract was, and as you'll see in the next slide, we're actually under budget even on that portion. So the 9 months of the year is what the CJ was in effect for in 2023, because obviously we started in April, we went through December. The total the total CJ was 1.371 as you saw before. The total bill, for 9 months that would have been 1.028 million, and then the actual billing was 1.015 million, which is about $13,000 under budget, without including all the additional work that we did on top of that. So it's actually a savings of greater than that, but I really can't quantify it because I can't quantify how much Dan I spent on House Bill 110 down to the dollar. So some of the things that we did extra with that, still having that savings, were the implementation of the operation and maintenance, holding after-hour meetings to discuss septic system requirements with residents, trustees, councilpersons, House Bill 110 work, following up the nuisance complaints that hadn't been followed up for in darn near forever, working with the Amish DDC clinic, Parkman Wells, and then other services that were improved as well. So again, I can't give you a dollar threshold that would be for every one of those, but it was significantly more than expected, and that's how it worked out. So it went very well for both sides, honestly.
You should include replying to public records requests just on that final.
I honestly may have to add that. That's a
mean,
very solid point.
Yeah, fulfilling public records.
Yeah.
requests.
It may be
solid
more time
point.
than anything else.
Yeah.
That's gonna be 100+ hours.
It was definitely a lot. And for so Melissa, you were not here. The rest of the board was way more. So just the House Bill 110 thing, between Dan and I, for 3 weeks, the hours were like 100 hours, 10 hours, 125-ish hours in those 3 weeks. So it was like 360 hours for each one of us with all those different things worked. So it was a lot just to get through all those with the lawyers. So the primary benefits for Lake County Health Department, the one for GPH after this. But the primary benefits were the reduction overall cost of management through the cost sharing with GPH, ability to retain more qualified staff, staff receiving experience in areas that are not prominent in Lake County, such as septic. It's big here, it's a little bit less in Lake. Increased staffing pool to draw from the programs from emergencies, improved communication with Geauga County elected officials for issues that cross county lines, and increased communication with federal and state representatives through programs in both counties. So the previous slides were all GPHs. These were lakes, a little more narrowed down for that one. But again, it was a benefit to both significantly, mostly with the overhead management reductions. Opportunities and obstacles, because obviously those
Can I just ask a question?
Yeah.
Have you gotten any feedback in Lake, like that people think it's a bad deal? Because, I mean, obviously we get that in Geauga that people think it's a bad deal, but I mean, if I was gonna be,
Yeah, we had
I feel like it's worse, like,
Yeah.
if you were to say who has the short end of the stick, like, I think
would be
Geauga
more
gets
arguable.
far more benefit than
We had-
Lake does.
We had a couple, but it was, I know we talked to our HDAC and just kind of went down it, and we said, hey, we're not losing money, and I think we've asked for a 0% increase for 2 or 3 years in a row now.
So we
And
certainly.
so they're happy.
Okay.
Said trust us on this one. We had a lot of risk. It made us think the additional risk we were taking on, and it was that enough benefit to Lake County to take that risk on, and we stand behind it. So we have a lot of vested interest in making this work the best we can. But yeah, if you're honest, I mean, I kind of feel like we did extend a hand for the right reasons for the people, and
Right.
it may not be as sweet a deal, but in
Right.
the long run,
No,
it
that's
makes
right.
sense with partners.
Okay.
At the same
Just to have
time,
some skin in the game.
at the same time, you see the people across Ohio, but Lake and Geauga see the Parkman Wells disaster, and what an incredible response that was, and things got fixed and turned around. And that has to get some comfort to the Lake people.
Yeah, I mean, I think so. I mean, I think
Absolutely, yeah.
we've heard more positives than negatives, and honestly, I think if Had Lake have went to their HDAC and said we want a 3% increase or a 5 or an 8 or whatever it would be, I think you'd have a different story because they'd be like, well, hey, if you're saving money, why do you need more money? And instead, I think we've done 0% for 2, maybe in 3 years, and that's because of contracts like this that are reducing overall cost while still doing all the services, and it's just maximizing staffing time is what it is.
Yeah,
Not
it's
that no
probably
one's
the first
busy.
couple months before and 6 months afterwards, but I mean, to date now, we don't get any of that feedback really negative at all, but it's all positive really for us.
Yeah.
As a
Well, maybe that-
physician, I can say that being involved in hospital systems, there used to be, I think, 38 individual hospitals just a decade and a half ago who were members of the Greater Cleveland Hospital Association, 38 unique hospitals. And now they're essentially 2 plus a few
Right.
outliers by
Yeah, UH and Cleveland Clinic, right?
And
Right.
Metro.
Metro is,
Oh, Metro.
has to
Yeah.
be independent,
Yeah.
cannot
City Hospital.
fold into another. So we went from 38 to 2. And that was all done for economies of scale.
Yeah.
I think people would agree that the quality of the care at the institutions that in those 2 hospital systems has only gotten better, not worse,
Absolutely.
by improving those hospital partnerships and acquisitions. And I have enough gray hair to have been through the process of all that consolidation and the pain that was associated with it, but the net has been a positive. And so I think
Great point.
very similarly, we're dealing with economies of scale here. It's literally impossible in today's healthcare delivery system to be able to operate when you are a individual, small hospital entity. Just your need for access to data is
Yeah.
overwhelmingly costly when you're a small, single, solo institution.
Yeah, being siloed and isolated doesn't benefit patients and, in our case, the public. I mean, the connectivity and the collaboration is what makes things better, and I think that trickles into this.
Yeah. No, I think we're definitely seeing positives across the board. Like I said, just the complaints going down alone, getting to the nuisance complaints, getting to those, actually getting them out like relatively quickly.
Yeah.
You know, it was a comment at the HDAC was, hey, you guys are actually doing those. Like, yep, we are.
And
Like
not
you were.
just staying afloat, but growing.
Yeah.
And that's what we
Yeah.
have the opportunity, what we've shown in the past year is growth, not just trying to keep our head above water.
Yeah.
Yeah, and to do both during the pandemic and everything else, really, behind the scenes is phenomenal for everybody.
Some opportunities that I at least identify were new perspectives on grants and programs with being able to access those together. Access to a larger staffing pool in emergencies, staff redundancies. So actually right now we have someone out who's been out for almost a month, and Gina Parker, who's trained in Vital Stats, has actually been filling in for that person, so we have not had to hire additional people to fill that, and that's Vital Stats. It's actually one position still held by GPH. We haven't hired anybody to do that. We're actually doing that with current staff, and we've been doing that for almost a month now. So that right there has saved $3,000 to $5,000 right there. That is just not, it's not in the contract, but it's shared. Cost sharing just in general, the innovation through partnership, better utilization of management obviously is the key one. The obstacles were obviously the CJA rollout. I think there's some things we would all probably have done differently, I think, with how we rolled that out, how we communicate things, but hindsight's 20/20. Communicating changes with staff, that was a tough one. Internal changes with how rapidly those were implemented, and then implementing a new management structure. Honestly, I mean, given that, I'm somewhat subjective, given that I was part of it, but I think we did a pretty good job for, in essence, flipping a switch like that day. And it was like, hey, as of tomorrow, we're doing this. And we did that pretty quickly and really didn't lose a whole lot. I mean, there were some growing pains, but it worked out. The other reality, as I mentioned to somebody else who wanted to see this, was and I'll mention more in the analysis section, but if you want to do this somewhere else, the real key thing is you have to have at least a handful of people who are willing to work 60, 80 hours a week, at least for a year. I truly believe that's how you make it work. So Dan Lark, myself, Ron, Gina, it was Marianne before. You have to have those people that are like, hey, I'm going to do this. It's going to be like a goal we're going to achieve, and then my stuff will even back out over time. If you don't have that, I don't think you'll succeed, because you got to have somebody who's going to stay here probably till 8 or 9 o'clock and say, what didn't work out today? How do we fix it by tomorrow? If this didn't go well yesterday, how do we fix it before tomorrow? So those are all things that you're doing, like, honestly, texting in the middle of the night, texting, or calling each other and trying to figure out, like, at 9 o'clock at night, how do we have that not happen tomorrow?
Yeah.
So those are important. The benefits realized in 2023 for GPH, so the first 9 months. GPH maintains sovereignty over policies and regulations in Geauga County, utilization of prior experiences of staff to oversee rollout of operation and maintenance program. That one we hit on real quick. Mr. Lark has done this before in Lake, and he has a vast knowledge on these things. We've had other counties that have tried to roll out O&M up to 4 times, and it failed 3 of the 4 times. They're now coming to Mr. Lark and his team on, how did you do this? How did you do it so efficiently? How did you do it so cheaply? And they're asking us now to provide other people a platform, like a guide map on how to roll out the exact same program. So it goes to tell you how well that is going with that prior experience of someone like Mr. Lark. More consistent training opportunities, we do a lot of those. Access to larger staffing resources when employees take time away from work, as I just mentioned, we go with that one person. Increased services to the public with lower costs to the public. So we went over all those different things we've done with actually lower cost. Partnership with DDC to provide greater vaccination services to the Geauga County Amish population, and the GPH culture of positive change. So obviously, I think most of you have seen, or we have seen even with the public, they're like, it's very positive here. You walk in, you talk to sanitarians, they come out, clerks, everyone's very positive in what the future holds for them. Realized benefits in Lake County Health Department for 2023, reduction in overall cost due to cost sharing management, same as Geauga. New positions and upward mobility of staff for both Lake and Geauga. Improved communication services between providers and vendors. Staff gain experience with different populations, and additional opportunities for grant acquisition. All very important for anybody. And then just a conclusion, the CJ benefits both GPH and Lake County General Health District, LCGHD. GPH has significantly reduced staffing costs, increased services, retained qualified staff, more efficiently run programs, brought programs into state compliance and overall better serve the public. Lake County has increased the staffing pool with broader experiences, additional community partners for issues that cross county lines, decreased staff costs due to cost sharing, and retained qualified staff. And again, for both counties, because I've been in both now for at least 7 to 10 years, Lake County for 10 years, Geauga for 7, one of the big things from the day one I started in both of them was there's nowhere to go up. If someone is a manager, they're probably going to be there for 30 years. I have no way to go past where I am, so why would I stay past 3 or 5 years? Now we're having those opportunities with O&M and other things with, hey, you can apply. Hey, now that we're cost sharing, there is an opportunity for upward mobility. There is this, and this. So we're seeing a positive excitement from staff as well that they, because they don't want to leave, but now they have an opportunity I can stay and I can upward go.
Yeah, I was going to ask why you think that retention has been so good since the agreement went into place. You feel like it's an ability for that upward, part of that and just the culture has changed for the better.
A good culture shift. I think there's a lot of working with
but Ron's laughing, so I'm like,
I know.
I
was looking over to
he's
see
got it
what
off the
happened.
record.
I think it's part of it is just respect for staff and empowerment.
Yeah.
The communication is probably in the marriage business a big thing. I think it's just communication, respect, and then hard work. That's the rest of it. I think even
I
more
will
so than.
I will say, you can visibly see, at least from the interactions I've had with current staff versus, before we did what we did, was just the change in morale. I feel like they do have more support now. I feel like there was a period of uncertainty at GPH prior to doing this where I think the morale was really down, but once people saw the positive change, they were committed to being a part of that growth and positivity, and the morale just completely flipped, I think.
And I think it helped also, so when we did this, most of the staff got raises. I think the highest was about $5 an hour, probably the average was $1 or $2 off the top of my head if you looked at it. People were brought more into what the average is for the state versus being low. And for those who don't remember, or don't recall, or weren't here, the sanitarians, they were actually sanitarians back then, they were making at one point, I think when I started, $13.50 to $14 an hour was some of them were at starting. That average, because with Lake there's a union contract, we look at those every single year. I think that average at the time for an RS was like 22 or 23, somewhere in there. So 13 versus 23, you're probably not going to keep people at 13 for very long. And then even when we came up some, I still gave, I think, a $3.50 an hour raise to almost every sanitarian, just to get us up to where the average was for the state. Not even the average, we were just more in line with the state. And then we brought more in line with the Lakes union contract, where they are making more, but I think we're getting more out of them too. I think Dan, and I think the structure, sounds a bad word, but the structure has helped with that, where they go talk to Dan constantly. Some of the other team and even sanitarians come talk to me all the time. But the door's always open. We have an open door policy. They ask questions, they get answers. And they know our rule is, you gotta be courteous to the public. You can disagree, but you gotta be courteous when you disagree, because customer service still is one of the forefronts for, I always say that when you get pulled over, if the first thing you do is piss the cop off, you're probably getting a ticket. If you're mostly respectful, it goes where it goes. But as soon as you piss somebody off, it tends to be,
I hope the paper quotes that.
right.
Please don't say we are policing.
Adam said, "Don't piss off Sheriff Hildebrand's staff."
This is not.
I
but
want a headline out of that one.
Right.
Adam.
But I think it goes that metric of, when we work together, we go a lot further. If we start off adversarial, you start off adversarial. And when you have installers and service providers trying to do the best they can and keep up with what they have to, they are. I know, like Dan and I dealt with one a while back where, somebody was like, it was like 3 days late for their CEUs. And, you could charge them the late fee. Here in Geauga, they did. They charged them late fees. You don't have to. It's a could versus should. And the reality of, if you got your CEUs and you realize you screwed up, did you already just taint the water with that person by saying, hey, we're going to charge you a $300 late fee right off the bat? Or $200 at the time. Two or three. Three.
Oh, wow.
So that's a full, it's more than a pumping, because the pumping is usually $300, and that's not just pure revenue. So there's things like that where you just have to look and talk to the public and say, hey, how do we get to a place where we're both kind of happy, we both get what needs to be done. So, hey. So that is, besides questions and answers, that is my presentation. That was longer than I expected, but
How long is it supposed to be?
it can be up to, I think, 25 minutes. And
I
we
feel like
were
you're
pretty
fine.
close to that.
Yeah,
So,
we asked questions
Yeah.
during it, so.
but yes.
Staff, I think, had an opportunity to rebuild as a team, scaled back, and the money was changing, so we did more with less staffing, but they rebuilt the team. I mean, they helped.
Yeah, I
Work
mean,
together.
when you think, when I was coming on board, I mean, the mess that this was in. And.
Is that a technical term?
Yeah. We're gonna
In the
quote
end,
that.
Yeah,
No,
that's
no,
another
no.
quote.
I mean, nobody forgets all the controversy
came in
and, but in the
Yeah, tough
end,
time.
it's,
Catalyst.
we're incredibly grateful to the leadership that you all, and the work you all did. And there weren't any time limits. I mean, you did the hard work. You accomplished something that we're incredibly grateful for. And the people of Geauga and Lake incredibly grateful for.
It's appropriate for you all to be very proud of the work you did.
Absolutely.
I am, more than anyone knows. I mean, Dan, Ron, Gina, Marianne, who's now retired. I mean, the work that they all did, the hours they put in, the time they put in. The fact that Dan didn't leave me the day that House Bill 110 was discovered, that speaks.
Nobody
wonders.
cried too much.
It's I couldn't have asked to be surrounded by better people with everything that we accomplished. And I mean, I think 2 years probably would have been like if you get that done in 2 years, and it was done in like 6 months.
Yeah.
And I think it was pretty astonishing how far and how fast we went. I couldn't be more proud of everybody. And the team that's over there are your sanitarians, your REHS is now your specialists, the clerks, the team working on the website, the preparedness team. I mean, they're excited. I mean, you hear laughter almost every single morning as they catch up and they go through things and they're trying to build with each other and they talk to each other, work with each other for social media posts. It's great. I mean, just hearing them laugh and joke with each other and learn from each other. It's phenomenal. It's just great to see.
So do you remember the public, and I believe it was, the Maple Leaf was asking for, just sort of something like this to share with the public about what we've accomplished. Is there a way to take what you've presented today and somehow
Yeah.
make that a one-pager per se with the high-level points
So
of this to
we
share
will-
with them?
We will
Because
post
is an
this because it was,
accomplishment.
technically this is one of my private things, but it's
Right,
also,
right.
I had to do it for you guys
I
anyways.
mean,
we
you
said
have the
want it.
information.
Yeah,
but
so we are gonna post this as a
Okay.
document from us. I've gotta check, I have to change that one, right, I missed the one
The
savings for
2021.
2022 savings, but I'll go through and change those.
Mhm.
And,
We can update the frequently asked questions. I think may still be on the website from the contract and make sure it's all kind of synchronized.
Yeah, I
and
just
updated.
think it's, transparency, but also these are accomplishments worthy of sharing.
Mhm. Yeah, no, we did a lot, and I think if, my thoughts will post on both the website and the Facebook, 'cause that's an easy thing where someone can just link to it and read it and be done. And then hopefully the press release that we had will be out there soon too, saying that the annual report is up on the website
Yeah.
as well, which has some of that
That's true.
information also built into it. So there's a lot of good information there. I think it's working. I know the state and other people are looking at it and looking at, is this like the model to go forward? Because I know the ORC mentions mergers. I don't think most counties are going to be, I know it's in the code. I don't think most are gonna be enticed by a merger because there's so many downfalls for both counties. But I think if you look as a cross-jurisdictional or a collaborative or cooperative agreement, I think that's where you see what shines is Geauga gets what they want, Lake gets what they want, and we just work together to be better and reduce costs to the public, which, I was telling Dan the one day, I was talking to one of the food establishments in Lake, and I was talking to, they're all over the county in Geauga as well. And I was talking to their guy who used to be just their head of that entity, that area, and I never saw him anymore. I'd go in there to eat, and I said, "Where are you at all the time, man?" He goes, as a cost savings, he goes, I now oversee 4 restaurants. He goes, they're up to 100 miles apart. He goes, all I do is drive all day, answering questions, trying to solidify things, fixing things. And I said, that's all you do? He goes, that's my entire, he goes, I get paid well. He goes, that's my entire job now is manage 4 things. So it's cheaper to manage 4 and give someone a pay raise that keeps them versus manage 1 and have 4 of those different people in 4 different areas. And so, as Ms. Dr. Rude mentioned, the hospital is looking at the same thing. It's that economy of scale, it's the efficiency model. And the reality is, I don't, as a taxpayer like all of us are, none of us want to hear one more tax, one more thing. It's, that's what government does. It's here's one more thing you got to pay us for. Well, no, what can we do to decrease that burden, not increase that burden? So, I think we're doing that to the best of our ability. We are doing that, and I think the communication with the Board of Health, and you guys, get communications from myself, you get the board meetings. We just try to keep those open so everybody can ask questions and provide answers and do everything that way. So, but other than the final slide says my information, that's it.
All right, I guess you pass.
We give you an A.
Oh, there
I have
you
2
go.
more classes. I'm done in August. So
All right, that's awesome.
we're almost there.
Yay. Anything else on the administrator report you want to talk about, Adam?
No, nothing
I
else.
was like, you're like, that's enough.
I'm done. I'm out.
That was plenty.
I'm gone.
Now you're up to speed too. So
Yeah.
I thought that, you had that bullet point about updating the website and the Facebook calendar with, meetings, and
Yep.
I think that's a good idea.
Those did all start. We've already seen some positive things from those.
Okay.
We're working to put information on each one because they were just invites and not information. And the first thing was, what is this?
Right.
All right, here's
Okay.
a snippet.
No, I thought that was great. Okay. Health Commissioner report?
Yeah, I'll try to be brief. So Lake County was reaccredited for accreditation a few days ago. As we talked about, there'll be a special category for Geauga Public Health based on the annual report because of changing the building, lawsuits, those kind of things. It's going to take them a while. Unless you had any correspondence, I did not get any back. Not a bad thing. You have 2 more years for reaccreditation. By then, we'll have worked, hopefully, a bit of a miracle on changing the environment that we can become accredited under. I did provide you, just for your information, the Ohio Revised Code and the confidentiality, the resolution. It'll go to the county commissioners. If there's any feedback, just send it to me. I did talk to Christine Lakumiak, the director for the Lake County Adams Board. She's very excited about the participating. Left a message with the.
Geauga County Adams Board.
I'm sorry, Geauga. Thank you.
Yeah.
She
The
came
cor-
from Lake, though. They hired her from there.
Yeah, it was just stuff. The coroner, I left a message. We'll talk to the sheriff. Those are the positions on the committee, of course. And I think that's all I had.
And Adams Board was very excited for it.
Yeah.
She was very excited to have somebody else help, I think,
So-
tackling this with her.
Yeah, we'll get on the commissioners' list and we'll go from there.
So if no one is opposed, I don't need to vote on it, but we will take that to the committee. I have an email ready to go that asking, can we get on the agenda in the next, as soon as possible, maybe a month, but get on the agenda to get that approved by them, or at least reviewed. We had a discussion then.
The rest of the identified members of the committee will also be present if they can. I know Christine already committed to it when that time
Children's
comes.
always there.
So.
Good for him.
He is. He's a good guy.
Is the commissioner on or no? You just have to
The
get
commissioners,
approval
health
from
commissioner,
them?
sheriff, coroner,
County
Adams Board.
commissioners aren't on there though, right?
Correct.
No. Yeah.
Oh, health commissioner, I got you.
Yeah.
Okay. Any other questions about the health commissioner report? I always like these.
No,
I find them
thank you.
interesting. Okay, old business.
We went over Mr. Kaufman,
Yeah.
and just the reading again of the fees, to move those forward.
Oh, we didn't report on the public hearing, right?
Oh, yeah, go ahead.
So we had
sorry.
a public hearing, the 12th, I think?
12th, yeah, right before the.
For the
HDAC.
for the fee that's up, and,
Okay.
I guess we just had people who just, in general, weren't happy about an operation and maintenance program.
Okay.
in general, I guess there wasn't really many comments besides, I don't know if there's anything else you want to add, but there were just a few people not happy and.
We explained to most of them, they all signed a contract with the EPA, we're doing exactly what they already signed a contract for. This isn't, we're not the big mean bully here, they signed a contract for this.
A lot of it is more general questions about operation and maintenance, not necessarily, oh, I'm sorry, I have the wrong.
Yeah, I was
have
just
the
saying,
wrong meeting,
I was
I'm
actually
sorry.
telling you, we flipped.
I'm sorry, there's
there's two different meetings. The
We
meeting
had
on the
nobody show
12th.
up.
Hesitant.
Yeah.
I'm
Oh,
sorry,
no
we had
one
no,
showed up.
I was trying to remember, and the reason is no one showed up,
Yeah,
actually.
we flipped the two.
That sounds like a great meeting.
The other one was just an
Yeah.
O&M meeting.
Yeah.
The fee
Yeah.
meeting, we had one guy
Yeah.
show up 15 minutes late,
Right.
but he's actually a week and
Investigators.
15 minutes late. He
Yeah.
meant to be at the one the week before.
Yeah, so
Oh.
he was actually had comments about the O&M in general, not the
Yeah.
fee. So there's actually no one who showed up for that, so
Yeah.
I'm sorry, just.
Dr. Hendricks and I were sitting
Been a long
downstairs
week so
talking
far.
when he walked in 15 minutes late, and I said, "Don't worry, you're the only one here." And then when he came down, Dan goes, "He's actually a week and 15 minutes late. He was supposed to be here last week."
Yeah.
So
How time flies.
he got some one-on-one time with Dan and
Yeah,
the
yeah.
team. So he got all the
So
questions
we talked
answered.
about MPDS sampling with him, that's
Yeah.
what he was actually there for, not the
Okay.
new fee.
Mhm.
So what do you need?
We don't need anything for those yet.
resolution? We don't.
Reading.
Sorry, just the, Dan, do you know if this is second or third reading of these
It
fees?
says second.
Second, so sorry,
It should be the
just the
second
second
reading.
reading of those.
Mhm.
I
Um,
forget what we need though. I need a motion to approve the second reading?
Yeah, just, if you guys just want to do a motion to approve the second reading, which
Okay.
has not changed, the same as
But we
prior.
don't need to accept the resolution, right? Isn't that how that?
No, because we have to
Okay.
go three
Just
readings,
basically
then
just-
it's the fourth.
it's
I
not
get
the reading
confused
for
about these
reading
readings.
of the
Yeah.
fees.
We've done a lot of them and I'm still confused.
We have done a lot of
frankly.
them, yes.
Okay,
don't stop.
is there a motion to accept the second reading
I so move.
of the certain fees for the operation and maintenance program? Motion by Dr. Hendrickson, second.
Second.
Dr. Rude, all in favor, or do we need a roll call?
We can do a roll call.
Oh, yeah, roll call, let's
Yeah,
roll
Doc-
call it.
Dr. Rude,
Yes?
Dr. Henderson,
Yes.
Ms. Bowdren,
Yes.
I'm gonna do it again, sorry. Ms. Jones,
Abstain.
Ms. Braky?
Yes. All right, motion carries.
All right, so we'll have another fee reading next time, so we'll do it all over again next time too.
All right.
Start with the food fees again.
Dave,
Yeah.
Yeah, we'll get this down every time.
Moving on to new business.
Yeah, so the next one's an important one. It's the election of the Board of Health President and President Pro Tem.
All right, you want to do president? Does anyone else want to be the president?
Of what?
Is there- Would anyone,
Don't y'all jump forward at
Mr.
once.
Mueller wanted to make a resolution
Yeah,
about this.
that's right.
President? Oh,
The Board of Health.
oh, not the
You want
US.
Carolyn's job.
I mean,
Yeah.
I'm interested.
okay.
You want to be the president of the board?
Don't ask it like that, I'll get scared.
Is that-
No, I was just asking. There was jokes, and I didn't know if we were
Is
joking
that
or
o-
not.
Is that okay?
Yeah, no, that's
Yeah.
fine. That's
How do we,
fine.
what is the process? Do one of
No,
us
so,
have to?
yeah, somebody
Yeah.
has to make a motion.
I will
to-
motion to nominate Dr. Hendrickson for president of the
Okay.
Board of Health.
I'll
Se-
go ahead.
No, go ahead.
I'll second it.
Okay.
So it's a motion by Dr. Jones, second by myself. Roll call or all in favor?
Roll call.
Yeah, would you roll call? 'Cause he's
Roll
gonna-
call.
You could definitely vote for yourself, but,
Oh, yeah, that's right.
Dr. Rude?
Yes.
Dr. Henderson? You can say yes. Yes.
I abstain, but you can do whatever you want.
Ms. Bowdren?
Sure.
Yes.
Ms. Jones?
Yes.
Ms. Braky?
Yes.
Okay.
Oh, it's unanimous. It's,
Motion carries. We should probably move. Do you wanna do this meeting?
No.
Okay, all right.
He's excited, but not that excited.
Not that excited. All right, I'm not the president anymore, but I'll keep going. All
See
right.
what meat you guys picked? Look at the quality and the quantity of things.
Okay, so now moving on to the president pro temp. Ashley, you wanna do it again?
No, thank you.
No,
No,
thank
yours
you.
is good.
That was
Yours
fast.
is good.
Anyone wanna nominate themselves for president pro temp?
not a lot left, ladies and
Are
gentlemen.
we allowed to nominate
Dr.
someone
Dr.
else?
Rude was gonna nominate somebody else there
Yeah,
for a
you
second,
can-
I think.
I was like-
I was gonna,
You just want to check to see if they accept
I would
the
like to
nomination.
nominate Dr. Rude for president pro tem.
Dr. Rude, do you accept the nomination?
Yes.
He was gonna nominate somebody else, he was like.
This is how it goes. It's
There's
just like,
$5 under the
Uh,
paperwork and
okay.
send over.
All right.
Dr.
So there was-
Henderson seconds.
oh, Dr. Henderson sections. Okay, roll call vote. Let's roll.
Dr. Rude?
Yes.
Dr. Henderson?
Sorry.
Wait a second. Yes.
I know, do we
Ms.
all
Bo-
have to
Ms.
finish?
Bowdren?
Yes.
Ms.
That'll be
Jones?
quoted.
Yes.
Ms. Braky?
Yes.
Okay.
Motion carries. We have a new president. Okay. Resolutions. where,
Right by.
right here, okay,
Uh,
financial reports.
I'm gonna do two things real quick.
I didn't do this one.
The changes to the 2023 appropriations, or rescinding, sorry, we're rescinding one of the appropriations. We didn't do the transfers in 2023 due to the House Bill 110 and what that was gonna impact potentially. So we need to rescind that because we never actually did them, due to we didn't know how fast that money was being transferred out. And, yeah, so that's the most important one. Just to know why we're rescinding a 2023 is because we never actually implemented them due to House Bill 110 amongst other things.
Wait a minute,
So-
can you say that one more time?
Yeah,
I'm
so-
sorry.
There's 01, 02, and 03. The 03, which is permission to rescind November 2023, just a heads up. Those were all the transfers we were doing out of the other funds in the general fund.
Okay.
We didn't do them because of House Bill 110 and some other things going out.
Okay.
There was a little bit of nervousness as to when we had the money to cover the expense, if that firm had said, hey, we ship it all out tomorrow, I can't transfer that money out because now we need the money again. So we're actually rescinding that so that it never happened, because it never happened.
Okay.
Usually we don't rescind things, this is one of the times we're actually rescinding something.
Okay, any questions on the financials before we,
They were short this month, I would say.
well, that's what I was gonna ask,
Yeah.
so why were they so short? Why were you not spending money?
You know, I just thought Vicky was watching me and I figured I shouldn't open the paycheck or the purse. No, ironically, it was just, there wasn't a whole lot going on. Usually at the beginning of the year, there's not. It'll ramp up more when the sanitarians are out in the field, the environmental health specialists. And then when the trainings start ramping up, we'll be doing that. We will also have the credit card statements for you guys starting next time,
okay.
so you can review them. There's not a lot that goes on that, but we do use stuff on occasion.
Oh, that will be exciting.
So will you
Credit
put
card
that as
statements
a
to
line,
review.
will you put that as a line item or a separate statement?
Probably what we'll do is we'll just attach it with that, and you
Okay.
guys can
Print it
look at
out.
it. Yeah,
Okay.
'cause
Okay.
I think that the most glamorous thing we've bought so far was something for sanitarians on Amazon. It was testing supplies for my dad. That's the most glamorous thing we've
Chlorine
bought.
test strips.
Test strip, yeah.
We're
Bugs on
gonna
those.
ask every month,
Yeah.
what's this from Amazon?
Usually I would buy the things and I get reimbursed,
I would
but
say, do you get points with this credit card too? What
uh,
are you gonna do with this?
Lake does have points. They go towards the general fund, which is
Okay,
required
I
by
was
the
actually
code.
curious about that.
Yeah.
Yeah, how that works.
We'll give you
Okay.
Points back.
Oh, the only thing I've got to show you a visual, but like, what's going on here? Is this like a
That
description that got cut off? Do you see what I'm saying?
Those print right out of the system, so I'd have to double check.
Yeah, it almost looks like that this
It's
is
not
like
like
a
all of them.
longer description that got, so I
I'll have to
just
double
wasn't
check because
sure.
the ones right above that one did too on the back.
Oh, yeah. Yeah, that's what I was just
I'll have to
wondering
ask.
what that was.
I
I
don't
just
know.
was making sure that it wasn't, something that got hidden just because
Yeah.
it was so short this month.
I'll have to ask. It looked like it was off the top of my head. That just looks like it's a printer.
Okay.
But I'll double check.
All right, is there, a motion to accept the financial reports, resolution 24-03-06-01-01?
So moved.
A second.
Okay, hold on. That was Dr. Rude
Mhm.
started it.
And then Dr.
Dr.
Hendrickson
Hendrickson smacked it down, okay.
Pro tem and prez.
Did I,
I think you put.
this is for the,
That would never
What's this for?
this is for the resolution for the financials.
Yeah, that's just the financials, just that one.
Yeah.
Dr. Rude.
Oh, I put Dr. Jones, I'm sorry.
That's okay. That's why I was like, Dr. Rude did it.
Oh,
I mean,
I think I was thinking, okay.
that's okay.
It's all right, we got a lot going on. All
She's
right.
like one's pro tem, one's not.
Yeah.
I am no longer.
Adam, roll call, or we just yang and nang?
Those, I
Oh,
don't think
no.
anything that,
Yeah, we just yang
yeah,
and
there's
nang.
nothing that you would have, couldn't
Okay.
vote on.
Yeah,
You're,
just
you're
the
good for
financial
that, all in
statements, yeah.
favor?
Aye.
Aye. Abstentions, nays? Okay.
And
That
as an FYI for
carries.
next month, you guys will have more bills, probably the usual, but we'll have some legal bills as well,
Okay.
because obviously we had the records request that they're working on. That one they mentioned last time was, I think it was 8,000 pages. We're still working on the rest of that. They're not, I still help them with a lot of those things, but I don't have time to do 8,000
That was
pages.
submitted electronically though, right?
Correct, yeah, it's anonymous, so, I'm a big fan of public records, so I'm not digging on them, but it's
Are you
those things of like,
Argument.
I can't do that much, there's just no way.
Okay, so now, so that was the 6.02.01,
Yes.
so now we need, a motion to approve appropriations for
And
increase.
I think that it actually was, we are not gonna do that, if I
This
remember
one we're not
correctly.
doing?
Yeah, the next one, that's the third one. We're not gonna do increase and decrease, we didn't need
Okay.
those.
So that one's out,
Yep.
but now we're gonna screw up our numbers. Okay, is there, a motion to approve resolution 2024-5, Permission to rescind November 2023 appropriations for increase, decrease.
So moved.
Okay, that was the doctors again.
Sorry, that's
Hold on,
that's the next one.
So-
That's this right here.
Oh,
There's nothing for that one, it's just
There's something
rescinding.
that I'm trying to make sure I abstain from.
Yeah,
Sorry.
there's
Oh,
nothing
that's the
needed,
cyber
yeah,
area.
there's
Okay.
nothing,
And something to do with
so there's nothing
Why is
needed
that
for
going?
60203, it's just you guys saying yay or nay, and that's because
Okay.
it's just rescinding, we're not
All
doing
right, so
anything.
that was Dr. Rude, right, made the, motion, and then,
Correct.
was that Dr. Henderson, did you second? Okay, all in favor?
Yeah.
Yes.
Aye.
Aye.
So the next
Opposed.
one,
Hold
I'm
on.
sorry.
Opposed, abstentions, motion carries.
All right, sorry, I jumped on that one. The next one, the permission to amend the 2025 geographical budget, that's for next year. I mentioned this at the HDAC. I did not, and my apologies, did not account for taking out the dollars for the House Bill 110, because that should have been done in 2023, and it was not, due to like trying to reconcile all those accounts. So I needed to reduce that by $1 million, that fund balance, so that that money is not counted again. So I go to the Budget Commission, and they say you have $3.5 million. I'm gonna say I only have 2.5. It just hasn't come out yet, but we know it will. So all we're doing is that same budget you guys did last time, with a reduction of $1 million roughly to the 6023, the sewage fund. So if you guys approve, which I think you can all vote, well, we do roll call. They want a roll call on this.
They want a roll call.
Yeah,
on this.
sorry.
It's overall budget, so that's.
Okay,
fine.
so is there a motion to approve resolution
So
2024.5, a resolution authorizing the approval of the 2020-25 budget? Okay, so that was Dr. Hendrickson,
Mhm.
Second.
and Dr. Rude is the second. All right. Roll call. Adam, let's go.
All right, Dr. Arud?
Yes.
Dr. Henderson?
Yes.
Ms. Bodrin?
Yes.
Sorry. Ms. Jones?
Yes.
Ms. Brakey?
Yes.
Great in first impression. Just
Motion
keep
carries.
trying.
Okay, cyber air review.
The next one is the gentleman that came in to us that asked to have his fees,
Yes.
or his permit, sorry, credited back to him. Dan has an update on that, at least with some general dates, because you guys kind of want to know when this occurred. And then we can go from there, so.
Is it in the report? I believe?
Yes.
Okay, sorry,
It's
it
on
isn't there.
page 2 of new business.
Sorry, so if you look at that, this did not happen yesterday. I'm not saying, you guys can decide what you want to do, if you want to
Right.
refund this or not, but these are case-by-case basis if we do refunds or not.
So who asked for the refund?
Mr. Fredo.
Yeah.
So the one from
Well, who else?
2018?
So, yeah, if I remember right, he bought the house in 2018 and lived there to 2021 and sold the house in
Put it up on there.
2021, if I remember the dates correctly.
Okay, so when was the system put in?
Was that 20? when he sold it or
Alteration
when he
permit was
bought it?
issued in July 1st of 2021 for tank replacement.
Yeah. So that
Oh,
was
I
when he
see. So this is
replaced the
whole
cyber air, though.
This is the
Yeah,
whole.
So the
sorry.
cyber air was placed in
I
2018,
gotcha.
I believe, when he bought the house.
Yeah, sorry.
I got you,
Prior
okay,
program.
all right.
And then at some point, he must have been having some issues, and then that 2021 date is when he paid for a new system to be put in there.
So, did you remember what the permit fee at that time was?
I think it was 435.
435. So, again, it's case-by-case basis if you guys want to or not want to. And there's no, the question you had last time for me was, when was it done? Because we were not, like, my assumption was, from what you guys were saying, you didn't want to keep going back forever. Like, it wasn't like we were going back to
Yeah.
2007. This is 2018 roughly is when it was put in. 2021 it was yanked out. What do we want to do with this? Do we want to refund the permit fee? Do we want to say, hey, it's been out there long enough? I don't know. I mean, this is
I
up to
feel
you
like the
guys.
statute of limitations is up on this. You know, it's been, because it's 2024 now. Kind of a lot of time has passed since they've asked. for
Okay,
the-
we can take that back to them. I mean, that's
I mean,
again,
that's just my personal, I mean, with the last ones, they came kind of right away, right, when they
yeah.
replaced the
Mr. Lark and I were
system.
dealing with them because of
I
the
think
what was
it's nearer
happening.
to the time of the
Yeah.
installation.
Right,
And they still own the property also.
Mhm.
versus this has been
It's changed hands. The property
multiple
has.
years, the property's changed hands.
Mhm.
Was there a reason for that?
That it changed hands, or that he came now?
Well, that it's been so long.
He just heard about that we did the other ones, and it may have been inferred to him that it was gonna keep going, and so then I told my brain to all of you, because I said, that's not a decision that Dan or I, to my understanding, have an authority to make. That was something that you all wanted to have the input on as to, and also I think it's good practice. Dan and I, nor Ron or anybody else should be offering refunds unless it's mandated. You know, if someone overpays their fees or whatever, that's a different story. But I shouldn't have the authority to just willy-nilly say, you get something back, you get something back, unless it's very specific. And this is not what I'd say is a commonality.
I mean, and the other part, the reason we don't feel comfortable doing this, it is paying for the health district to do the work for the inspections and that kind of stuff.
that's what I was
And
gonna
so we
say.
did do our part, I guess, of that.
Yeah,
also.
I mean, we've provided the service,
Mhm.
and it's not, I mean, it's, you know, it stinks that these, sorry, no pun, that the systems don't work. But, that's kinda not, it's not GPH's fault that it doesn't work.
And adding a new system does add value to the home, so I would think that there had been some benefit to that. If
Yeah.
that's the you know, scenario beyond that $400 fee.
Yeah, so, well, I mean, it sounds like when we're saying no to this
Well,
one.
I mean, I'm just saying no, I don't know how everyone else feels, but
Yeah.
anyone else have any
Chime in.
contrary opinions on this?
No contrary opinion, I agree with you.
Okay. All right, so I think
So,
that's,
All right, Dan, do you want to reach out to Mr. Fredo tomorrow,
Yeah.
if you can? All right.
I mean, it is an unfortunate situation, like,
It
do
is.
I feel bad that,
Yeah.
that this happened, but you know, ultimately, the health department is not
Mhm.
who is in error here.
Yeah. Yeah.
Okay, do we need an exec?
We do not.
Good, that's what I wanted to hear. All right, anything else for the good of the district?
I just quickly, I know we're gonna go on this, our Public Health Combined Conference is at the end of April. I'm looking at the new table, if you guys would like to go, Adam and I
Oh,
will be
public comment.
down there.
It wasn't on the agenda.
And do that, also
Oh, I
probably
see.
present
I see.
information on the Association of Ohio Health Commissioners, they have training as well.
Yeah. So if, anything you guys would like to attend, I'm sorry, I mean to interrupt you, Dr. Rube, go ahead.
And just FYI, I will not be here at the next meeting, I'll be out of the country.
One day as President Pro Tem, and he's like, caution to the
Just-
wind.
just leave it.
Hold in
Sorry.
sick.
Who's the president pro tem?
Back to Ashley.
No.
That's the way it goes. Yeah.
Dan is gonna, Dan did have a list they sent to Mr. or Dr. Hendrickson of some upcoming, it's more like septic and sewage and EH side stuff. We can get that to the rest of you if you're interested. The health department can pay if you guys would like to go to something like that. Ron just mentioned the combined one that is a really good conference, to some degree.
When is it?
April 29th, 30th, and 31st, I think. It's a combined conference in Columbus, and then the AOHC is usually downtown Columbus as well, but they do more targeted one-day trainings for new board members or it's a good overview.
Yeah.
But I'll get you more information on that.
And you don't have to be there all day or every day. Like you can go for a day. I think like Monday's mostly the slow stuff. Tuesday, Wednesday's when it picks up for that one
It's a
specifically.
good experience if you have not attended or want some
Yeah.
more global perspective.
Usually Ron and myself go. I think Dan, you've gone.
No, I usually go to the more environmental health
environmental
specific
one.
ones, yeah.
And then usually the medical director goes to the
Yeah,
one.
so fall has a fall conference, which is more just health departments and the medical director tracks. Spring is usually with the Ohio Public Health Association, so it's a little bit more health education and public health. But they're both very good.
Dan's too cool for it. So,
All right, public comment?
would anyone like to speak?
2 minutes?
I just have a question.
Oh, my timer. Oh.
Time's out
now.
I'll do it just so nobody yells at me.
Yeah.
Oh, it's gonna be good. When there's public records requests and the information is on the website, do you have to look it up or do you just direct people to the website for that?
So
Or is it in the Ohio Revised Code? I don't know.
My understanding was you still had to provide it,
Yeah,
right?
we still
Even
have to
if it's on-
provide it.
Yeah, you can't just link it.
yeah,
So
and
you can't just email them back and say, hey, it's on the website?
If-
now, what I will say
Yeah,
is,
if I
the
like-
average person I communicate with, if I say the minutes are right here, they go, oh, okay. Or, hey, here's the document. Oh, okay.
Okay.
There are some that may say, no, I would like them emailed to me via this Dropbox, and that is how we'd like it had. And, or print it out, or whatever they want, and we do that. And
You're
then
just lucky to
there's-
get very large record requests as compared to very specific
Yeah.
singular requests, which is different.
Yeah. And we do rule some out. I mean, there's, Mr. Costura rules out a number of records requests that he says are overly broad.
Okay, good.
But it's
Yeah.
still, they,
So check and verify got their information?
I think they've gotten almost all of it. The first document, I think that Mr. Costura mentioned was, I think, 8,000 pages. And then there were some other documents that we spent a good chunk of a day looking for, here at the health department. and we had to go through all the minutes from 2010 until 2020.
Up to the president almost, didn't
Yeah, I think it was
Yeah.
present. It was
Yeah.
present up
Yeah,
until
that's right.
January 2024, and we went through all those looking for anywhere that City of Chardon was mentioned because it wasn't super descriptive on what City of Chardon did. So we did all that too. So if anything, it was a good team building
History
thing
lesson.
for the staff, honestly.
Team build-
It's
I'm
not the most
sure they
exciting
want
thing,
They prefer
but
trust falls, I think. than-
Yeah.
They're looking for City of
hurts.
Chardon and a bunch of documents. I would anyway, maybe.
Yeah.
Someone also told
Ropes
me
courses.
that like
High
that,
ropes.
If someone from China could
Icebreakers,
ask for a
anything.
record,
There's in Lake, as an example, I fulfilled one during COVID, if I remember correctly. It was from South Carolina, and they wanted. I don't remember what they wanted. It was a plethora of information, and we had
Yeah,
to provide
there's no
that to
residency
someone in South
requirement.
Carolina.
Really interesting.
Yeah.
And we've also had people. I think I mentioned to yourself and the board one time. We've had people that come in, and during COVID, they wanted every email or notice when someone wanted a COVID test kit. Those are COVID test kits are considered medical devices.
Yeah.
So those have to be redacted, but for all the information.
Mhm.
There was 40,000 pages I think we had to go through, and that person, when I specifically asked, he said he literally, well, A, he was mad at us because he wanted more COVID test kits than he got, but also B, he was very upset that, or he said he was just looking to see if he could sue us. So,
He specifically
He's
said
on.
yeah,
that?
wasn't even shy about it. He goes, I'm looking to follow one of these through to a lawsuit and see what happens.
Does his first name start with a B and last name start with an A?
I actually don't remember who it was. I couldn't tell you.
We know who she's
Then,
talking about.
hold on, I have one more question. So, just so you all know, I just want you all to know, I didn't do records requests, I did records request of who was requesting.
It's still a records request, technically. Yeah, that's a public
But this is
record.
very specific.
8,000 pages.
No.
I just got one little
And,
page.
and if it's relatively easy, I just handle those myself. Like for Vicky, I gave her a list of what we had with Easter Sure and just sent it to her. I think I don't go through the lawyer if it's nothing, if it's not HIPAA related. Like we just kind of ship those out. So, but yeah. So
I just had to verify who I thought it was, so.
And check, yeah.
Yeah.
Yes.
Check and verify.
I can verify. Check and verify.
misspelled too.
Yes.
Any other public comment?
I had a couple quick things, well, I hope it.
First time ever. Holy
Oh my
cow! This is
Oh,
exciting,
nice.
people.
Yeah.
Look at that video.
I don't think HJAC
You're
has
right.
a website of their own.
They do not.
No.
Can we not put their meetings on our health department website?
I think it's in process, isn't it, or no?
Well, so
I mean, I know there might be some legalities
I
there.
think that's the problem.
So what I am worried about is they're technically a totally separate entity from us. They're not part of the health department. The other thing was if someone were to put in a resume for the Board of Health as an example, and I don't give it to the HDAC, I'm now liable. And God forbid somebody thinks I don't like him and they go, oh, he didn't like me, so that's why I didn't give them to him. Because even though it may say submit your things to Chris Olashek, who's the president, they may just do the easier thing, which most people do, and that is contact us, submit form. The other reality is the HDAC is not represented by our lawyers, so I can't even really ask because they're not represented by our lawyers. So unfortunately, it is.
We could ask our attorney, is it okay if we post these
Yeah,
things to the calendar?
and I think it's more the liability we're taking. My understanding is it's more the liability we're taking
Yeah.
on. That now we're responsible for their public records requests. We're available, or if
just
someone submits
post the
resumes.
meeting notice?
What's that?
Just by posting the meeting
Yeah, I think
notice?
you
If someone,
repost the
because they can
meeting
submit those
notice.
through there, and then what do we do with them if it's not us? Like, do we take them? Do we
But
not
like
take
if
them?
Chris said, hey, our next meeting is September 1st,
Mhm.
and you said, okay, I'll put that on the calendar, that would be an issue?
So my
That's what I'm just trying to
yeah,
understand.
the concern I have with Chris, which I can ask our legal, is
Yeah, ask,
the concern was
you're worried about creating a duty.
yes.
That's what you're worried about. But,
Because someone will abuse that as soon as I give it to them, they will
Yeah, I
abuse
know.
it.
Okay.
That's my
That's
only
what I'm
concern.
just trying to understand because my brain doesn't work.
Yeah, that is my only concern is if we miss something or don't respond to something,
I
are
got
we
it, and
liable
then you
for
are
not doing
liable
it?
for providing something
And
like.
then you have to put a little, the little disclaimer on
Disclaimers.
the bottom.
I see what you're saying.
I
Yeah,
am
but-
not responsible.
but we
Yeah,
do want the
yes.
public to
Yeah.
be able to know when
Yes.
these meetings are
Yeah.
coming up. I mean, don't we usually have them in the upcoming?
I thought
We talked
historically, like,
about
on our
it.
agenda, we would say like
Right, the
the
next
HDAC
meeting
meeting is
is-
March
That's what I feel like the
13th.
meeting minutes might be a
We-
applicable way.
We talked about it, and I think it was in the meeting minutes that, like, I think we said it's going to be X.
Yeah.
Yeah, I mean, I'm not opposed to posting it. I think my somewhat fear is the duty responsibility of then responsibility for the HDAC.
Yeah, but
And what comes with
let's
that.
ask about that, because we do wanna be transparent about, with the public about when anything.
We could put a section in the agenda, just upcoming meetings or something like that.
Yeah, I think we used to do that.
And that way they'll know where to look, cause that's the other problem, if it's happen chance, to be
Yes,
challenging.
and just making sure it's in the same place every time,
Right.
regardless
Yeah.
of what it is.
Just make it a
Yeah.
7-0, whatever.
Cause I think that was part of the problem too, is maybe it's not in the same place every time, but now I mean, I didn't even, I should have known, because that's where we put the meeting notices for things, would be in the legal section,
Mhm.
right?
Yeah.
But maybe a lot of people didn't know that, so.
It's possible.
It's in the meetings section too, you know, like all
Yeah.
the county meetings, everything is there. Every
Yeah.
township
Yeah.
meeting, everything, it's a little at the bottom of the newspaper, one of the pages.
Yeah.
Yeah, and maybe that's just another thing to be advocated
Yeah.
for, is where to find, where's the central location,
No, I'll,
which is
I'll
that.
ask,
It
I'll ask
creates a
Linda.
historical trail.
Yeah, I don't mind posting it, which my concern was the, well, I'm
Yeah,
getting
no, that's
GBH enrolled
understandable,
in.
because if they cancel or change something, then people show up and get mad at you.
Yeah, so yeah,
That too.
that's fair too.
Yeah.
Okay, Mr. and Mrs. Kaufman, oh
She's-
no,
she's
more,
like one
we got
more.
more, I'm sorry.
She's going all out
Okay,
today.
the whole reason for this joint thing, or one of the many reasons for this joint thing, was to have, be able to get more grants and stuff. Have we applied or gotten any?
Actually, the one just we were looking at was the cardiovascular health grant. It just actually popped up like 2 days ago. So my staff put the letter of intent in on behalf of us, and we're looking at the funding mechanism to see, that being both healthy counties, who knows what the point system will be for the state, but we are actually using that first one.
Yeah,
Okay.
they're-
I know it's only been a year, and I know those
Yeah.
don't come around often.
And we did
but
apply
I was wondering.
for a mosquito control and
Yeah.
surveillance grant recently, so we're still waiting. We should hopefully hear very soon otherwise.
A lot of them are cyclical, so we're just waiting for that
Yeah.
next cycle. We did apply, I mentioned at the
There's
HDAC.
one
um,
other one we
I thought the
applied for.
emergency, wasn't the emergency
Yeah.
preparedness or
Yeah,
something,
we-
that requires a health commissioner that we wouldn't have had before? or-
Correct.
Yeah, you
yeah.
had to have
Okay,
that.
so that we wouldn't have qualified for if we didn't.
No, you'd have had your own health commissioner, own epi, own nursing director.
You need the full
and
triad.
EH director.
Yeah.
So,
And
Yeah,
that's a
triad.
substantial one, right?
yeah, that's usually a 5-year competitive cycle.
Yeah.
and-
But
Okay.
dollar wise, it's only like 120 or 130,000.
Oh.
So it just, and you have to employ a preparedness specialist and an epi. It does not
These are
cover, it does
all
not cover what it
deals.
requires, even
Yeah,
close.
normally you need a full-time FTE on both sides. Together we get to 1.5 FTE. We don't actually split people. And, so, but we can have a tracking table of grants applied for, value and status. I think we talked about that last time.
Yeah.
So this will be the first one where we develop that tail and we have a running list.
I did mention at the HDAC, I did apply for a grant for Parkman and for City of Chardon for new snow plows.
Okay, thank you, I'm like,
plows.
we did something for snow
Yeah.
plows too,
Yeah.
in my
and
head, and I'm like, was that?
somebody
weird?
sent it to me, and I mean, it was literally due the same day it was sent to
Yeah.
me, but I filled out what was necessary, and I,
And we got it narrowed down to.
yeah, there's
the top.
still, there's only, like, I think, I forget how many are actually
20-something
getting it,
counties
it's
in it
very
now.
few, but
Yeah.
there's still a lot left, but we're still in the running, so it'd be great if we could offer up Parkman and City of Chardon, like, you
I
know,
mean, we get a lot.
$30,000 plows.
Yeah.
Why is that public health?
It actually,
I think it's ODOT
The
or
wells.
something.
I mean,
I-
that's asking a dumb
It was a
question.
stretch. We were just trying to
So
help out.
the grant was based on
Access?
chlorides,
I
which
don't know.
somebody didn't know what to do with it, so they sent it to me because the townships really don't seem to apply for that stuff. And they're like, "You could do it." I said, "Sure." I
Sounds
said,
like
"I'll
an
apply for all of you."
Yeah, okay.
But if it
So-
helps it be more efficient in their application of salt, which was part of the issue with
Yeah.
the
Yeah,
Parkman
right.
wells and all
Right.
that stuff. And it's not the first time there's been well contamination from road salt, so
Right.
it allows a reduction in road salt. It'd be more efficient than theoretically.
It was a service.
It was definitely the first time I applied for snow plows in my life. I've never applied for that as a grant.
We have reached out to the Cleveland Foundation, which is always somewhat skim on funding Lake Geauga jurisdiction anyways, especially Geauga. So we have new competitive application starts up in August. So I've talked to the rep and looking forward to some senior services and cognitively disabled and some of those things that we could happen. And he's very excited about that. So we're waiting to see when that opens up.
Ed, you gonna up to your wife now? You have 3 things?
No, I was just gonna tell you, have a good vacation.
Thank you.
Good question, though.
Anyone else in the back?
I just have a quick question. Now, what you guys were talking about with Lake and Geauga County, is that merge totally done or no?
So it's I'm only saying this because it's a very specific thing. So it's not a merger; it's a cross jurisdictional. Because merger would mean there's
Collaboration.
no more 2 boards of health, but it is fully in place. Yes, it was fully in place April-ish of last year.
Okay, that's what I thought, that's why I was,
Mhm.
I thought it happened last year.
It's kind of the perspective of we've cooperated before, but this is collaboration, which means both sides give up something, both sides gain something. It's a little bit more intimate.
But
I guess
still
is the
keep their
term.
sovereignty.
And so that's where we're at.
Basically,
Yeah,
the simple version.
it is.
Yes.
Yeah, exactly.
All right, anything else? Board, we good? All right, hopefully we have less public records requests,
Hope so.
going for a little less
Yes.
chaos.
Yeah.
More services.
Okay, all right, everything will go back to normal.
All right.
That'd be great.
Back to
Knock on wood, one of
business.
these days.
All right, meeting adjourned at 6:29 PM.
Everyone, please take some of these snacks home. I'm not taking these with me.